Just tell me a little bit about kind of your background, what you do as a doctor.
So historically, I was just your average internist that basically tried to care for people. I also owned a lot of my own clinics, and so we typically saw about 200,000 patients a year, had about 250 employees. And so when COVID came along, it really required me to kind of figure out what's going on, not only from the patients that I've got to take care of, but also for my employees as well. And so that really what kind of drove me to get really almost hyper-focused on trying to figure out the problem and actually figuring out how to help people. And so in a sense, a lot of my knowledge base is interestingly fairly new because a lot of this was new, but if you actually applied yourself at the time, you could become an expert in something that was relatively new, relatively quick. And
let's not forget, this was not only new for you, it was new for everybody, from the top doctors in America to the interns, to the residents. What were some of the things that you observed in your patients during COVID that sort of stick out to you to this day?
So it was pretty obvious in the spring and summer of 2020 that we weren't really dealing with a respiratory infection. What we were really dealing with was a vascular issue in the lungs and vascular issue everywhere. And in fact, what my collaborators in South Africa really discovered is we were barking up the wrong tree. It wasn't a respiratory disease, it was actually a vascular disease of the lungs. And that's one of the reasons, if you have a vascular issue of the lungs, the worst thing you can do is increase the intrathoracic pressure, which is what ventilation does, and in a sense is why most people that got on the ventilator did not live. So in a sense, what we discovered was if we attack the vascular and coagulation or the clotting issues that go on with COVID, that we could pull people out of the hospital, save their lives, and actually not have any long-term consequences.
For those who have never studied, the body, what is vascular?
So vascular would be the vessels. So, there's two things. A lot of times when we think about pneumonia or asthma or those kind of things, what we're thinking about is how we move air in and out of the lungs. But the interesting thing is when you move air in and out of the lungs, it has to interface with something called vessels for that oxygen exchange. And if you have a disease that attacks the vessels, you also have, a lot of people are monitoring their pulse ox and those kind of things. The actual pulse ox goes down as well. And so what really a lot of physicians started to realize is we were treating this like the classic, what we call acute respiratory distress syndrome or ARDS pneumonia, but it wasn't that. And in a sense, what we needed to do was treat it as if it was a vasculopathy. And some of the people that I work with in England, what we kind of define as what we call primary pulmonary vasculopathy, which is a fancy word for saying the issue is a primary issue of the vessels of the lungs, not necessarily the airways, which is what most people associate when they think about a pneumonia.
And I think a lot of people would be surprised to hear that the ventilator actually could have contributed to people dying. Is that right?
100%. Yeah, it was actually, if you think about the vessels, if you already have vessels that don't work very well, what's the worst thing you can do to them? Actually blow more air in them, increase the intrathoracic pressure, and actually close down more vessels and actually make the oxygenation worse.
Let's talk a little bit about, I know you've written a lot about the COVID vaccine. What are some of your big takeaways from what you've learned about it?
So the interesting thing was what we knew, and actually when we talk about coagulation and how things attack the vessels, was that the spike protein was really what was causing that. The spike protein attaches to this thing called the ACE2 receptor that's present in the inside of your vessels, and that's why COVID is really a vascular disease. But it was interesting as we started to understand COVID and understand that the pathogen was the spike protein, that the solution that was offered was actually to tell people to make the spike protein for an unknown amount of time for an unknown amount. And that is actually where we got off. Meaning historically, when we think about vaccines are passive, meaning your body interfaces with a foreign protein. But usually that protein is not something that's active biologically to most people, but instead to pick the very protein that is pathological and actually have people make it in a way that we didn't really even understand. Even the biodistribution studies are just now catching up, where the old "it stayed in your arm" is completely false. And we know that now, but of course the studies just came out because really we weren't studying it before we basically told everybody it was safe and effective. So in a sense, it is what I would consider not even in the same classification as a typical vaccine, and it's kind of the redheaded stepchild of vaccines. It's almost the person you don't want in your family because it's going to ruin the reputation of all the others.
And is this all the vaccines or just
the mRNA vaccine? And so the mRNA vaccine is...
But that was Pfizer, that
Pfizer
was
and Moderna. Yeah, and then I will say the Johnson & Johnson was an adenovector vaccine. So it used the capsid of a virus and had your body utilize the outside of a virus called the adenovirus to actually have your body be attacked and replicated. But it was in a very different way. We also had a lot of history with utilizing adenovector viruses to vaccinate. And so we had a lot more data on what was going on. The mRNA was a technology that isn't new. But even in 2018, the NIH itself said that this technology had lots of holdups. And actually, a lot of those holdups are the very adverse events and adverse effects that we're seeing, which is we didn't know where it went. We didn't know how it impacted things. We didn't know how long people were going to produce it. In a sense, think of the mRNA as almost like a blueprint that you're giving your cells to make the protein. And again, a protein that we knew was pathogenic. And the reality is we don't know how everybody reads those blueprints and how long they read those blueprints and how long they make the blueprint's effects. And that's a very different thing. That's called active. It's an active mechanism as opposed to a passive mechanism. A passive mechanism is you take a small amount of a protein or a other kind of live attenuated basically vaccine, and your body interfaces it. But we interface with a known amount of the protein. This is very different in a sense that we're actually making the body make something for an unknown amount of time, for an unknown amount. And then the other thing is the biodistribution studies, specifically recently in a paper in January of 2025, showed that it actually targeted things like the ovaries, the heart, the liver, those kind of places. And again, that just shows you the lack of knowledge about the biodistribution when we thwarted this on the entire population with the mantra that it was safe and effective.
During the height of the pandemic, we were measuring deaths by the millions. Tens of thousands of people a week were dying. Are you advocating that the vaccine not be used? I mean, this is crediting with saving lives and from making this a global pandemic to something that we only talk about, once in a while.
Yeah, I think the vaccine itself is questionable on whether it saved lives looking at the data. Does that make sense? And so the other thing is what they knew about the technology is it would rapidly cause mutations. And so in a sense, everybody got vaccinated for something and protected them. And by the time they were vaccinated, that virus wasn't the virus that was attacking them. And in a sense, that means that the vaccine continued to have to be boosted and updated. And that's not a way to actually engage with the immune system. In fact, the immune system doesn't necessarily like being poked all the time. And then sometimes if it gets poked all the time, it roars. And so the onset of new autoimmune diseases and other inflammatory syndromes are kind of just out of control. There was a recent meta-analysis that looked at autoimmune diseases in children, and in the vaccinated, and this was about 400,000 kids. In the vaccinated population of children, there was a 0.2% increase in autoimmune diseases. That doesn't sound like many people, but when you think about it, that's about 8,000 kids that have a new autoimmune disease. That doesn't seem like something that we should be doing to children, especially when they had no benefit from it.
What would you credit then in terms of getting the pandemic under control, if not the vaccine?
Well, in a sense, it's actually what we call viral evolution. In a sense, the viruses themselves, if they are deadly, that's not a benefit to them. Very few people get infected in a morgue. And so in a sense, what it does is attenuate over time to become more infectious and at the same time be less virulent. And that's just the natural history of how viruses work. And that's what we saw over time.
I want to talk about long COVID. I know there's some recent studies that have linked long COVID to some of these vascular issues. You have a problem with some of those studies. Talk a little bit about that.
So I don't necessarily have any problem with it. I mean, I'm probably one of the people that look. I guess that I don't have a problem. What study do you have?
So the one, I think that I read that you question some of the links to the vascular issues and long COVID because you say they haven't asked the vaccination status of some of these patients.
Yeah. So I think the problem with the problem with the context of long COVID is because now we have really basically a society that's been vaccinated at the same time that they got COVID because the vaccine didn't work, that it mixes the data and basically no one is being asked, when did the onset of these symptoms happen? Was it temporally related to your COVID or was it temporarily related to your vaccine? Instead, we're throwing them all in a basket and basically saying you have persistent symptoms after COVID, but in a sense, no one's actually chronologically going back and asking them. It's one of the deficiencies in all these studies.
I know during COVID you spoke out about kind of what you were seeing and you were kind of shunned. Talk a little bit about kind of the reaction from the, establishment medical class in America in terms of the narrative and kind of trying to shut out other voices.
Yeah, I think in some ways medicine is a very hierarchical profession, and in a sense, even in residency in medical school, we're taught to think that the people above us are infallible and what they say is the only thing that can be said. And what the last 5 years has exposed is when there isn't somebody that's questioning the narrative, that the narrative actually in itself could be completely wrong and the outcomes can be completely awful. I mean, just another example recently would be Alzheimer's research. Alzheimer's research, they were focused on something that was completely fraudulent for the last 20 years and only funding those studies that went along with that narrative. It's the same thing that happens, and I think that's one of the reasons that the medical system continues to need independent physicians and independent research. The problem with really Fauci and a lot of the things that actually the NIH did over the last 40 years is they tied medical research to following the narrative that Fauci and Anthony Collins decided. And in a sense, that means that there is no science.
I'm going to have you say that again because Francis Collins, right?
Yeah, Anthony Fauci, Francis Collins, mixed their names, Francis Collins. And basically they were going to fund things that agreed with what their narrative was. And in a sense, science, the other thing about science is science, you hear a lot of follow the science. Science is not a leader. Science is an informer. It gives you data. Leaders lead. They utilize science to make effective decisions. And if you ever hear a leader say follow the science, they're actually abdicating their responsibility to somebody else instead of actually leading as a leader.
Let's talk about myocarditis. This is something I read a little bit about. I think a lot of people don't know about it, and I think you might argue that they should know more about
100%. So myocarditis is inflammation of the tissue of the heart, the muscle of the heart. And why it's such a deleterious thing is you really don't get new heart muscle. So if you actually have the heart muscle attacked, you don't get new muscle. If you have your arm attacked, in a sense, you can actually rebuild new muscle. But cardiac myocytes don't come back. And that's one of the reasons heart disease is such an awful thing, because in a sense, once cardiac muscle is destroyed, you're in for a long, hard life because you're not going to get new cardiac muscle. Now, I will say there are kind of researchers that are looking at ways to actually make new heart muscle, but currently that isn't the case. And so when we're talking about children or young men that have myocarditis is a significant thing. They might say that, for instance, they might feel better after 6 months being treated by ibuprofen or colchicine or those kind of things. But in a sense, they've had an attack of the heart muscle that for the rest of their life will not be different than that attacked heart muscle. Does that make sense? So the long-term consequences, if you look at 5 to 10 year studies on people that have myocarditis, they're awful. And so in a sense, when the CDC and FDA were saying, hey, myocarditis, but it seems self-limited and people seem to go back to their life, we're talking about 17 and 18-year-olds without any benefit are actually having heart damage, the heart damage that will last the rest of their life. That is never a good balance at all.
What's the connection to COVID and myocarditis?
So COVID or the vaccine?
Or the vaccine.
Yeah, so the vaccine uniquely, when we were talking about that mRNA, the research that came out in January looked at lipid nanoparticles, which is what actually the mRNA gets wrapped in. And interestingly enough, what they found is the LNP, the lipid nanoparticles with the mRNA, actually go to the endothelium, the inside of the vessels of the heart, and actually cause changes in multiple proteomics, meaning like what they produce, to downregulate repair and upregulate inflammation. And in a sense, what that proves is exactly what we thought was going on, which is mRNA vaccines cause myocarditis. Now, the problem was this was being seen very early in the CDC and FDA data. We're talking April or even March, actually even back to February. The interesting thing is, as much as the FDA and CDC were telling you they had this program called V-Safe, V-Safe, interestingly enough, only asked questions about fatigue, fever, rash, didn't ask anything about chest pain, shortness of breath, palpitations. And so as the Israeli data came and started to see this signal of a significant amount of young men, especially after the second dose, having myocarditis, the CDC and FDA started to actually, from the bottom up, by physicians that weren't scared to report, started saying, hey, we're seeing this in these patients that are young men. We need to do something about it. The CDC and FDA were about to basically give something called a health alert notice. And that health alert notice would have told physicians, hey, be on the lookout for this because this is happening. Not only that, the Israeli data confirmed it. But at the same time, the people were saying, well, we don't have a signal yet. But they didn't have a signal because guess what? You don't have evidence if you'd never visit a crime
you're not
scene.
Asking the questions.
And they actually had multiple people from their own agencies come in and say, hey, we're missing this because we're not asking the question. And in a sense, when they were about to elicit a health alert notice to all the physicians, the worry was more about, if we tell doctors to look for it, we might get more of it. That's your job, by the way. And if doctors aren't reporting it, we'll never have the signal. And so instead of actually giving a health alert notice to all the physicians, they decided, with the help of the Biden administration, to actually just update the website of the CDC instead of telling the physicians. And also were communicating with Moderna and Pfizer, letting them know what they were doing at the same time that they were all saying, hey, we need to be careful because we might drive vaccine hesitancy. Well, the interesting thing is, vaccine hesitancy is one thing. A 17-year-old with a damaged heart for the rest of his life is another.
So that health alert notice never went out?
Never went out. And that's what we're discussing today.
Yeah, so that's my next question is kind of what are you doing here in Washington today? Why was this report kind of put together, and what are you going to be talking about?
So a lot of it is looking at the failure to notice, meaning like literally the job of the FDA, the job of the CDC, and the FDA more than the CDC, is to actually regulate our products and inform practitioners and people about the dangers that they might see as soon as they see them, and then they need to be proactive and get them off the market or restrict them to the people that don't only need them, meaning people that don't have that deleterious consequence. And in a sense, they didn't do that. In fact, the CDC went around, instead of basically giving a health alert notice, they decided to update the website at the same time that they told Moderna and Pfizer to update their labeling. And so now all of a sudden the labeling starts to say myocarditis. Again, this is 2 months into this discussion. But at the same time, the CDC hasn't said anything about it, which is an interesting way to do it as well. Then lastly, some of the interesting things that were part of the actual health alert notice that never got sent out. There was many additions to continued claims that we know for sure they were saying that the benefits outweigh the risk, at the same time that they don't know the risk, and in fact the risks are just developing. Mm-hmm. So that is a complete lie, because you can't know that, because it's a brand new product that's under an emergency use authorization. So if you're going to have a health alert notice, it didn't even get out to us as physicians. I mean, as physicians that are asked to actually tell people to get this product based on somebody's word at the CDC and FDA, to tell our patients that we have a long history and a long relationship with, that this is safe and effective and it's the best decision for your 17-year-old, that is crazy to think that how many physicians went with the word of these people as they debated whether it should be released.
Can you just tell me why you think it was more prevalent in young men than women?
So there's a couple different reasons. There's actually hormones related, so testosterone actually. So one of the things in terms of the spike protein actually getting into the cell, it has it's actually basically potentiated or increased its ability to get inside the cell if there's a testosterone receptor engaged. And guess what males have? More testosterone. It also has to do with catecholamine. So again, it was just kind of the actual makeup of a male was more likely to have that effect. Does that make sense?
Yep, totally. So, as far as the report that's going to be released today, what are some of the glaring, red sirens in that report?
Well, the glaring thing was they knew about the V-Safe not being effective. And the V-Safe was the way that basically patients that got the vaccine were supposed to report back to the CDC and FDA about side effects. And those side effects that they listed were the very minimal side effects. There were 10 things that were listed. They did not list chest pain. They did not list shortness of breath. They did not list palpitations. They basically listed fatigue, mild fever, those kind of things. And in a sense, it was brought to them in April to say, we're not getting this signal because no one's being asked the question. And instead of actually updating the list of things that would be asked to the people that were in that database, they actually just restricted the amount of calls they would make to people to only call people that went to the doctor. Mm. And I will remind you, in 2021, if you had chest pain or shortness of breath, you weren't really somebody that was ready to jump out and go to the doctor because we were told not to seek medical care. So in a sense, they were restricting even more reporting by saying the only people that we're going to call and actually inquire with are people that visit the physicians and the hospitals.
Just a couple more questions for you. Have we learned, what lessons have we learned and what lessons have yet to be learned from this pandemic?
So I think the first thing is open-mindedness, and that science is not a closed book. okay? And in a sense, especially the way our medical system is run, the problem is over time as consolidation. I mean, most physicians now are either employed by some type of corporate entity, they're employed by the government, or they're employed by some academic medical center. The problem with that is most of those places receive their funding from one big place, and it's called the NIH. And so going against the grain with what the NIH would say through their agencies like CDC and FDA means that you're on the chopping block. And in a sense, that really restricts the ability to think outside the box. And so what we need is actually people that, first of all, realize medicine is about taking care of another human who's not only physical but spiritual. And that makes them different than rats. And in a sense, if we treat everybody like rats and look at a lot of spreadsheets, you're going to get exactly what happened in the last 5 years. And that's not what you want from your doctor, and that's not what you want from society and the medical system.
Do you think that, with President Trump's, people like Dr. Marty Makary at the FDA, different people that he's brought in on his medical team, do you think that things are heading in the right direction?
Yeah, 100%. I think Marty already, even the announcements yesterday in terms of what they're going to do in terms of further approvals for vaccines for COVID-19 that came out, where they're going to actually have to require, especially on the boosters, that there needs to be randomized controlled trials, that they're going to restrict it to only people with significant health conditions. I think this is the first step in the right direction. Instead of a trust us, we know, and then find out later that they didn't. That's really what the changes are making. And I think some of the biggest things that have happened in good ways are getting rid of somebody like Peter Marks. Peter Marks was actually head of CBER, which was basically the regulatory body involved in actually approving and licensing vaccines. Yet at the same time, in the summer of 2021, was on YouTube advocating for the vaccine. In a sense, that's not his job. That his job is actually to regulate the very industry that he was out promoting. And in fact, even if that industry went on YouTube and promoted their vaccine like he would, they would be fined. And in a sense, he thought it was okay, and he's never been held to account for it, and I think he needs to be.
Just last question. We've talked about the vascular issues. We've talked about myocarditis. Are there any other issues that you've come across, either in patients?
So the other thing that we see is clotting dysfunction. And so clotting dysfunction is downstream from endothelial dysfunction. But when we think about clotting, a lot of people think about blood clots. And I'm pretty sure most people have noticed that maybe somebody that they wouldn't have expected has had a blood clot. Heck, the NBA and NFL are full of them that you would think, why are these guys having blood clots? They're literally active every day. But if you inappropriately activate the endothelium in the coagulation system, you cause a cascade that causes fibrin to form inappropriately. And a lot of what I study, especially under the microscope, is looking at what we call abnormal amyloid fibrin. So amyloid fibrin is like, typically we want our body to make fibrin in response to a need to stop blood flow. And in a sense, what that usually looks like is spaghetti that just came out of the colander. It's basically, you're able to pull it apart when it's needed to. The actual fibrin that's formed because of the spike protein actually looks like burnt spaghetti casserole that you have to get a Brillo pad to get off the casserole dish. That's not easy for your body to break down. And in a sense, what that does is cause a cumulative process and result in clotting and dysfunction, especially in the small vessels. So a lot of people that we see that have long COVID or persistent issues after the vaccine, a lot of it is not necessarily the big vessels. It's actually the very small vessels where red blood cells line up and actually get oxygen and other things out to the tissues. In a sense, I usually use the metaphor, it's like you standing in your shower and no water's coming out of your shower head. You call a plumber and the plumber stays out in your yard and tells you your water main is open. That's what a lot of the cardiologists and doctors are doing. You would fire that plumber. But in a sense, what's happening here is instead these people feel awful. Their big vessels are fine, their small vessels are destroyed. And in a sense, small vessels are what matters. It's what actually gets you the shower. They knew, again, early in the vaccine rollout, they had a list of all the possible vaccine adverse events that they should expect to see. And they limited that to ask people to 10 things that were really non sequiturs, meaning people feel fatigued, people feel, like they have a headache, those kind of things. Not questions that were like shortness of breath, chest pain, palpitations, those kind of things. And in a sense,
how does not asking the right questions impact the health of the country?
Well, if you don't ask the right questions, in a sense, you're not going to know what's causing it. Does that make sense?
Yeah, totally.
So, again, it goes back to, it's like, as we see increased cardiac event rates in society, we see early coronary disease or actually young kids with lots of new arrhythmias. A lot of doctors, and I deal with them all the time, they don't even have the framework or the lens to think that COVID or the vaccine might have caused it. And in a sense, what they're left wondering is, this is the weirdest thing I've seen, but I guess it's just them.
I guess it's just an outlier.
Exactly, but it's not.